there. So I was thinking I would also talk about a retinal condition that I saw in emergency. I got a call, I was on call that weekend, and the patient said he just lost his vision the night before. So he was driving on a Friday night and he said that he was seeing perfect. Like actually his vision was 20/20 in that eye, and he just lost his sight. The second he mentioned something about seeing a curtain in the superior and inferior part of his eyes, I knew it was a retinal detachment. So the first thing that you need to do is, instead of sending the patient to ER or emergency, you need to see them. You have to on a weekend at around 9 o'clock. He had called me on a Saturday morning. I went to see him in our clinic and I dilated both his eyes, which is always recommended. You always dilate both the eyes, and as expected, I did see a retinal detachment. It was actually one superior and then two inferior. So the first thing that you do in those kind of situations is to let the retina specialist know right away. We are very blessed to have Dr. Robert Blem in our practice, and he does all our retinal cases. He's a retina specialist. He's just literally a phone call away. I called him and he said he would be more than happy to do a surgery on this patient, which he did. Amazingly, his vision is improving from no vision to getting some sight. Is amazing. It's remarkable. Some of the things that Dr. Robert Blem did on him, I just have to mention, it's a little bit technical, but he did vitrectomy. That's one of the surgeries. Then he also did a scleral buckle, and he did oil in his eyes, in his retina. So it's important from the patient's perspective again, because a lot of times patients worry too much. First of all, they get very stressed out, but it's something that's treatable, it's operatable. So definitely come to us, or call your primary eye care provider or eye specialist, number one. Number two, do not wait, do not delay, because sometimes patients think that, I do not have vision today, but it may come back. But that's not the case. You have to let us know immediately. And if there's an emergency, we're happy to see you at Lahi Total Eye Care. Thanks. Bye-bye.